Today we are hosting a conference on non-communicable diseases in partnership with Medicine Sans Frontiers, University of Manchester, and of course Kisii University on a partnership just to bring awareness on non-communicable diseases and the fact that they are neglected diseases that don't seem to get the discussion that they deserve and even the funding, considering the areas that these diseases actually prevail in the areas of disruptions, displacements. And so we are coming up as a team, researchers, academia, practitioners, and figure out how can we address this.
My name is John Riaga. I work for Medicine Sans Frontiers, also known as Doctors Without Borders. Maybe just to add slightly on what Prof said here, for us this partnership is important because we are in an academic institution and we are looking at matters research. And the other reason why this is important for us as Doctors Without Borders is because we are looking at the contexts where we work. In conflict, we respond to emergencies and provide medical care to those who need it the most. So what we are seeing about non-communicable diseases is the prevalence, especially in the areas where we work. It is not enough that we are speaking about refugees or people fleeing conflict or people who are faced with serious disease outbreaks. Then we are saying that at that point, those who are managing non-communicable diseases are predisposed to certain other elements. And that is why we are saying that it is important that we come together and have a discussion around this. Because we are speaking about epilepsy, we are speaking about diabetes, we are speaking about sickle cell, which is not very far from here because the prevalence of sickle cell in the Lake Belt, mostly the Nyanza region and the coastal region of Kenya, where it is really prevalent and a lot of people really struggle to manage. So this is what we are seeing as MSF, and this is what informs even the gathering that we are having here today, that we are able to just speak about these things, we are able to discuss them, and maybe someone is going to pick it up and say, we need to have this discussion, taken further from what is happening at the Kisii University.
The key disease among the NCD diseases is diabetes. There is a few more cancer,
Epilepsy.
there is epilepsy, and quite a number of them. They actually base all that comes in this category. So I think the spectrum. The University of Manchester has a long-standing connection and partnership with us, with Kisii University. So they're coming in twofold. One, because they are friends, we're working together in our medicine program. And number two is because they are hosting medicine Master of Science in Humanitarian at Manchester, UK, and they needed a way to have the students also experience these diseases or this program outside UK, and so Kisii was chosen. So the third really is because the students coming here get to feel really to what extent these diseases are infringed in this area, and apart from that, what can we come up with? So the professors from the University of Manchester, the professors from Kisii University, and the practitioners from MSF, we are coming up to the table and we are discussing, having a dialogue, intentionally figuring out how can we solve this problem, how can we work around it, how can we provide better services, how can we bring a discussion on the non-funding of this. The funding will be critical because without the funding, there cannot be research. Without the funding, then cannot avail the medication. Note that these diseases are neglected, and so non-governmental organizations like MSF now come in to support that area. And so until we get so they basically rely on the donors, they rely on gifts. So until we shed light on really the plight of these diseases, then the communication is not getting out. We are not understanding it. And then the academia must come in, figure out how can we improve this research in these areas of the NCDs. Yes. So the funding becomes very important.
Yeah.
Kisii University plays an important role in this discussion because first we have declared our niche as University of Health Sciences and Research, and number two, Kisii County is in the far-flung western side of the country. And as you can imagine, the remoteness or the ruralness in this region where we are located make us very susceptible to non-communicable diseases. And therefore, this discussion is important and urgent for us as a county so that we can push it within the region. That all of us, even the rural areas, how are we taking care of our people, our citizens in regard to non-communicable diseases?
But they have to dig into their pockets to go into medical facilities, and some of these medical facilities do not have medication. For instance, in Homa Bay as MSF, we are only available in 3 health facilities in the entire Homa Bay County. So people have to travel from far and wide just to come because we offer this medication free of charge. But that is not what is happening in the rest of the region. A lot of people who cannot get to Homa Bay, how are they managing? It is some of them are very costly, like sickle cell, for instance, is very costly to manage because when they have the attacks, they need medication readily available. So it is important that this discussion is taking place, that probably after this and moving forward, it would be possible to make management of non-communicable diseases a little easier for the populations around.
Good morning. My name is Dr. Kinyi David, the head of non-communicable diseases, Kisii County, and also the chair of the National Non-Communicable Diseases Caucus. I've attended this conference and the summer school that has been brought by a collaboration between Manchester United, Kisii County, Kisii University, MSF, to bring together different stakeholders from the globe. And this is an important gathering because it is an intentional move that we are seeing globally, that people are discussing about non-communicable diseases that run from cardiovascular diseases, diabetes, cancer, chronic obstructive pulmonary diseases, epilepsy, neurological diseases, and the list is long. Diseases that have been neglected over years, and this is globally. 75% of these diseases cause mayhem in Africa. So 25% accounts for the other continents. So this burden that we are talking about, 300% burden that is brought about by non-communicable diseases, is felt in Africa. A question about how much have governments done for these diseases. Personally, as a chair, I'm proud to say that I'm seeing intentional discussions, intentional solutions. A conference like this is to bring stakeholders together to discuss strategies on how we can improve, especially on funding to reduce burden. So something like SHA has come up. I know it's not a positive idea to all the populations, but it is something that is bringing to alleviate burden on these patients. Because you look at 300% burden, it's not a small joke. So counties like Kisii County is to ensure to increase budget allocation to non-communicable diseases. Small steps, but those are positive steps. We have a long way to go, but it only needs people who have intentional discussions to bring about alleviation to this burden. And that is why the stakeholders are here today and tomorrow to discuss about this, and especially on humanitarian crisis. Something that we also, during COVID-19, we all took our minds to how to manage COVID and forgot where these patients who have hypertension, diabetes, who are they going to, who will manage them? And these are the discussions we are having now, intentional discussions, so that in case there's a disaster like that or there's a crisis like that, how should we manage these patients?